A very good evening to all the doctors present here. I'm Dr. Shweta Ghadge from the medical team of USV, and I welcome you all to the CME India program on metabolic challenges in aging population. It is my honor to welcome Dr. N.K. Singh sir. Sir is the Director of Diabetes and Heart Research Center, Dhanbad, Chairman of RSSDI Jharkhand, Executive Member of National RSSDI, ex-governing body member of National API, ex-chairman of API Jharkhand and CCDSI BJ. Sir has edited Millennium Book of Medicine, Associate Editor of Postgraduate Medicine to 2021, edited Monograph on COVID by ICP API 2023, over 40 national and international publications, admin and founder of CME India WhatsApp group, editor of cmeindia.in and diabetesdhrc.com, and sir is fellowship in WHO. I welcome you, sir. I would also like to welcome Dr. Akash Singh sir. Sir is currently the Senior Consultant of Medicine, Diabetology and Non-Interventional Cardiology from Vadodara, Gujarat. Sir has been invited as as a faculty in national, regional and state conferences, principal author in several publications in international and Indian journals, reviewer of the International Journal in Diabetes, and sir has been the book author of Management of Diabetes Mellitus, a complete practical guide. I welcome you, sir. I would also like to welcome Dr. Bijay Patni sir. Sir is currently the HOD of Diabetes Wellness Clinic in Kolkata. Sir has memberships in ACP India chapter, ISH, CCDSI, ISCM and DRWA. Sir has contributed in articles and chapters, including independent studies in journals and books. Sir has achieved a fellowship of Indian Society of Hypertension, fellowship in Indian Society of Chronomedicine, fellowship of American College of Physicians, and fellowship of Diabetes India. Sir, I welcome you and I hand over the session to Dr. Bijay Patni sir to take the session forward.
From just 1 minute, Dr. Patni, on the behalf of the CME India platform and USV, I welcome you all. And then Dr. Bijay Patni will conduct the session also. So, Dr. Bijay Patni.
Thank you, Dr. N.K. Singh, and thank you, Shweta, for introducing me and our fellow colleagues. So we are having a very interesting session today on the aging population. What are the metabolic challenges? And we have Dr. Digimed to speak on the topic. And to moderate the session, we have Dr. P.K. Singh sir and Dr. Prabhat Agarwal. So I welcome both of you. And can we have a series slide? We will introduce Dr. Digimed a little later. Can we have Dr. P.K. Singh sir's slide? Yeah. So Dr. B.K. Singh doesn't need an introduction. He's a past chairman API Bihar chapter, past chairman of RSSDI Bihar chapter. He's a governing body member, National API. He's a regional and national faculty and more than 20 publication index journal of national and international publication. Welcome, Dr. Sir. And Professor Prabhat Agarwal, he is a professor of medicine of SN Medical College, Agra. He is a FRCP Edinburgh and Glasgow. He's a postgraduate diploma in diabetes from UK. He's a fellow of Diabetes India, fellow of RSSDA as a UPDA. He's a governing body member of RSSDA UPDA. Welcome to Dr. Prabhat.
Thank you. Thank you, sir.
So I will hand it over to Dr. B.K. Singh to introduce Dr. Digimed and the topic.
Good evening to all of you. And first of all, I introduce Dr. Digimed. He is a well-known diabetologist and well-known figure of all over India. But Dr. Digimed is MBBS, MD in renowned general physician in Kanpur, currently practices Bridge Medical Center. Practicing as physician since 1983, a special interest in diabetes. He has several membership like Association of Physicians of India, UP Association of Physicians of India, the Research Society for the Study of Diabetes in India, and the Hypertension Society of India. And today's topic is the metabolic challenges in the aging population. May I request Dr. Digimed to please start the session. Dr. Digimed, sir.
So, thank you, Dr. B.K. Singh, for introducing me. And thanks to Dr. N.K. Singh, Dr. Akash, and Dr. Patni. And my topic today is aging population. What are the metabolic challenges? Aging itself is a problem. So there are many challenges in aging population. And metabolic challenges are one of them. I will touch upon certain metabolic challenges that we face day in and day out, and how to handle them, how we can go for healthy aging, what drugs can be used. So that is what is going to be today. If we define aging, it is an ongoing and irreversible but physiological process. We cannot say that this is reversible. This is irreversible physiological process which keeps on happening from the day we are born. After a certain age, it leads to deterioration of various functions. They may be at tissue and cellular level. This deterioration is slow. Aging increases susceptibility to various age-related diseases. That includes metabolic disorders also. So aging is the leading cause in metabolic diseases. If we look at the classification of aging, World Health Organization, WHO, defines that those aged more than 60 years are elderly. 1980, United Nations recommended 60 years as the age of transition for elderly population, and this can be categorized as follows. That is according to 1980 United Nations recommendations. Young old, 60 to 75 years of age. Advanced old, between 75 to 85 years of age. Very advanced old is 85 years and above. So this is the classification given by United Nations in 1980. What are the physiological effects of aging? Aging increases oxidative stress. Remember, it increases oxidative stress and it increases chronic inflammation as well. So these three interrelated age-dependent processes provide background to various systemic dysfunctions and chronic diseases. The systems mainly affected by aging are cardiovascular system, respiratory system, endocrine system, and sarcopenia from skeletal muscles. Interaction between these various factors, aging, oxidative stress, and inflammation, can lead to multi-system dysfunction and ultimately leading to frailty. Frailty with aging. These are the various risk factors that includes, if you look at the aging, the frailty in elderly is basically because of aging, but it can also occur genetically. There are certain lifestyles that we will discuss later on. Various environmental factors are also there, and certain diseases can lead to frailty. Frailty leads to chronic inflammation, and there can be active inflammatory process in various systems. The resulting changes can be seen in muscles, can be seen in endocrine system, blood and heart. What are the signs of frailty? That is weakness, weight loss, exhaustion, low activity level, and slowed performance that can lead to various outcomes like falls, disability, dependency, and risk in surgery, and ultimately leading to death. So, aging and metabolic diseases are interrelated. Aging is a significant risk factor for development and progression of metabolic diseases due to various physiological changes that occur throughout as we age. The environmental risk factors for aging and metabolic diseases are there. These are one which can be prevented. Medications, certain medications can lead to accelerated aging. Obesity and pollution is another very important factor for last half a decade or so. There can be behavioral risk factors like low intake of plant-based ingredients. This is very, very important. Processed meat and trans fat intake is another factor. Alcohol intake, smoking, physical inactivity, and sleep apnea, which usually occurs with obesity, is another factor which is behavioral risk factor for various metabolic diseases. These together, the environmental risk factor and behavioral risk factor, lead to altered metabolism, and that leads to accelerated cellular and molecular aging. There is metabolic dysregulation, which can affect brain, heart, liver, lungs, and can lead to diabetes. What are the mechanisms associated with aging? This term itself says that inflammation because of aging, that is called as inflammaging. Oxidative stress, telomere is shortened in our chromosome, DNA damaging, cellular senescence, that is called as SASP, reduced autophagy and immunosenescence can lead to aging. So all these together can lead to accelerated aging. There can be various age-related diseases. In heart, it can be heart failure. For last 10 years or so, we are listening about heart failure in aging population. It may be half PAF, the preserved ejection fraction, or reduced ejection fraction called as half RAF. There can be atherosclerotic diseases. There can be hypertension in aging population. Chronic obstructive pulmonary disease is another disease which occurs with aging. Parkinson's disease and Alzheimer, very commonly we see the memory loss associated with aging. Cataract and age-related macular degeneration in eyes is very, very important so far as loss of vision with aging is concerned. In ear, there can be loss of hearing, presbycusis. In prostate, with aging, there can be benign prostatic hyperplasia. There can be joints can be affected by osteoarthritis with aging. Osteoporosis is also known to occur with aging. Type 2 diabetes, we all know that more than 30% of elderly population may be suffering from type 2 diabetes, and in liver, there can be non-alcoholic fatty liver disease, or recently we started calling it MAFLD, metabolic associated fatty liver disease. If we look at the metabolic challenges in aging population, what happens? There is reduced testosterone secretion called as andropause. There can be reduced secretion from adrenal gland called as adrenopause, or there can be growth hormone reduction with aging that is called as somatopause. The various effects are shown there. This is the effect of reduced testosterone, which can be seen in the slide. There can be reduced dehydroepiendosterone that is being secreted by adrenal gland, and there can be reduced growth hormone called as somatopause, and the various effects it can lead to are shown there. I will not go into detail of each and every hormone which leads to various effects. Possible mechanism of age-related diseases. There can be effect at systemic level, effect on cellular level, or effects on molecular level. On systemic level, there is nutritional dysregulation in elderly population. At cellular level, various effects can be seen. There can be cellular senescence, as I have told you. Stem cell absorption is there. There is altered intercellular communication, which is seen with aging. At molecular level, there is genomic instability. The telomere shortening, which I have already told you, can occur with aging. Epigenetic alterations can be seen. Loss of proteostasis can be seen with aging. Compromised autophagy is seen with aging, and mitochondrial dysfunctions are many which can be seen in aging population. So these are the effects on molecular level, cellular level, and systemic level. Now, coming to common chronic diseases which are associated with aging. One being very common, high blood pressure or hypertension. There can be altered cholesterol with aging. Obesity can be seen with aging. Arthritis, basically osteoarthritis, is seen with aging, and maybe rheumatoid arthritis can lead to various changes in the bones if they are present in aging population. The ischemic and coronary heart disease is very, very common in aging population. Diabetes, chronic kidney disease, heart failure. Very common is depression with aging, and as I already told you, Alzheimer's disease or and dementia can be seen with aging. Now coming to hypertension in aging population. This hypertension has significant impact by accelerating age-related decline in health. So those elderly people who are also hypertensive, they tend to have rapid decline in health and functionality as compared to those who are elderly but not suffering from hypertension. This hypertension can lead to systemic inflammation. It can lead to oxidative stress and contribute to cellular and molecular aging. Hypertension is often related to various metabolic disorders like obesity, like insulin resistance, like we see in metabolic syndrome. It imposes strain on cardiovascular system that leads to accelerated aging, and it promotes heart-related complications in aging population. Hypertension exacerbates organ damage like chronic kidney disease, like dementia, like heart failure. These all can be seen with elderly population who are suffering from hypertension as well. Hypertension leads to speeding up of aging process when coupled with metabolic syndrome. Now, the second disease, which is very, very common in aging population, is diabetes. The prevalence rate of type 2 diabetes in elderly population is 30.42%. So that means that around one third, less than one third of elderly population have type 2 diabetes. And almost equal number of both sexes are affected. Remember, in younger age, the females are protected because of their hormones. According to one study, 64.04% of type 2 diabetes patients also have central obesity, and 80% of patients had associated hypertension. In people with type 2 diabetes, hypertension is a major risk factor for various cardiovascular diseases. Elderly patients with hypertension plus diabetes have higher mortality rate than similar age control without diabetes. Diabetes-related complexities or various target organ damage include microvascular complications, macrovascular complication, and these together, micro and macrovascular complications, play important role in aging of diabetic population. Nerve-related issues, that is diabetic neuropathy, eye-related issues, diabetic retinopathy, kidney-related issues like diabetic nephropathy, cardiovascular dysfunction, and hypertension. These are the key reasons for increased mortality in diabetic population. Very important is presence of dyslipidemia in elderly population. It is one of many risk factors which work together to contribute to cardiovascular disease. We all know that dyslipidemia, particularly raised LDL, along with hypertension, diabetes, smoking, and physical inactivity will lead to cardiovascular disease. There is raised plasma LDL level along with smoking, hypertension, and diabetes, which can contribute to development of atherosclerosis, and they lead to various atherosclerotic related issues. Concentration of plasma cholesterol tends to increase with age from puberty, unless it is familiar from puberty to 45 to 55 years of age of men, and then it may decrease, not always. In women, it continues to increase about 10 years later because of various hormones which go in favor of females, and they develop it 10 years later as compared to men, after which it declines in the last decade of. Very, very important factor is elderly and obesity. They say that as the age increases, the abdominal girth increases. Excess weight is associated with higher prevalence of cardiovascular disease. It can lead to various metabolic diseases. Several important cancers can be associated with obesity, and numerous other medical conditions can be seen in obese older adults. There is decline in physical activity in aging population. There is increase in sedentary lifestyle in aging population. Older adults of high and middle income group are particularly susceptible because of their sedentary lifestyle that they develop obesity. The prevalence of obesity or overweight was higher among older women as compared to older men. That is 23.2% versus 15.5% in men. Similarly, high risk of waist circumference, that was about weight. BMI goes up, but waist circumference, the abdominal obesity also increases with age. It is more prevalent in older women than in older men. Another important disease is arthritis. 9.36% of Indian population aged 45 years or above had arthritis. Females are more at risk of arthritis as compared to males. There can be more than 100 types of arthritis which can lead to various joint conditions. The most commonly found in elderly population is osteoarthritis and rheumatoid arthritis, especially in females, that can lead to debilitating joint condition. It leads bones to shrink, muscles to lose strength, the flexibility goes down, because of which elderly population is more susceptible to lose their balance. They have tendency to bruise, and they have tendency to increase risk of fracture of a bone. Increased calcium and vitamin D intake and strength training exercise is quite important in this elderly population. Weight bearing exercises like walking is important to keep bones healthy. Coronary artery disease is quite common in people who are called elderly, that is more than 60 years. 10.9% of adults aged 45 years and older are reported to have coronary heart disease called as CHD. 7.1% adults between 45 to 64 years are reported to have CHD or coronary heart disease. 17% of adults more than 65 years are known to have CHD. Female older people or older female adults are more likely to have cardiovascular disease than males, and they may present atypically. High blood pressure becomes a significant risk factor for coronary heart disease. It can become a significant factor for myocardial infarction also, stroke also, and very commonly seen in older adults. It is a leading cause of preventable illness and death. High cholesterol, diabetes, and physical inactivity are the key risk factors for development of coronary heart disease. Now we come to stroke. The chance of stroke occurring at the age of 55 and above is 1 in 5 women and 1 in 6 for men. The current prevalence rate in India varies from 44.54 to 150 per 1 lakh of population. And it is, aging is very, very important critical risk factor for stroke, which is physiological and cannot be improved. Studies suggest that various dietary preferences, sedentary lifestyle, and lack of exercise in urban population is the potential contributing factor for stroke. Older adults with sleeping problem are more likely to have stroke, and there is a study saying for that. It was found that hypertension is one of the major causes of stroke. Kidneys can be affected in elderly population. This is called as chronic kidney disease. Chronic renal disease is associated with increased incidence of dyslipidemia, premature cardiovascular death or disease, which is the main cause of death. Elderly patients experience an age-associated process of reduction of GFR. Glomerular filtration rate goes down with aging, but very elderly patients, they represent with increased risk of cardiovascular disease if there is CKD associated in death also. There is cognitive decline and frailty, which can also lead to chronic kidney disease. Renal glomerulus can suffer from consequences of organ damage caused by risk factors like hypertension, like diabetes. These are more common in elderly population, form of nephrosclerosis or diabetic nephropathy, causing end-stage renal disease and may lead to dialysis or renal transplant. In brain, aging can lead to Alzheimer's disease and dementia. Estimated dementia prevalence for adults more than 60 years in India is 7.4%. About 8.8 million Indians older than 60 years live with dementia. More prevalent among females than in males, more prevalent in rural area than in urban area. Due to aging and reduced DNA repair capacity, the DNA damage increases that gets accumulated in neurons, and this leads to enhanced cellular oxidative stress. There is increased inflammatory responses. These processes together can trigger age-related neurodegeneration. Another very important brain-related disease is Parkinson's disease that we see in elderly population, that is labeled as neurodegenerative disease or Parkinson's. Generalized incidence of Parkinson's disease in India is lowest from all over the world, that is 70 per 1 lakh of population. Incidence of and prevalence of Parkinson's disease increases with the age, being present in 1% of people more than 65 years of age. And as we age, the possibility of Parkinson's goes up. The chronic and progressive neurodegenerative disease with movement disorder is seen in elderly individuals. There are many studies which have found that older patients with Parkinson's have more severe impairment of dopamine function and higher level of tau proteins in CSF than younger population. Psychological problem associated with aging is depression. The common mental disorder, which is often underdiagnosed and undertreated among seniors, is depression. A recent systemic review and meta-analysis showed that prevalence of depression is around 34.4% of elderly population in India. Loneliness and social isolation have higher rates, and they are lesser in India as compared to Western population, because the more number of people live in old age homes as they grow older. Early recognition and early diagnosis and early intervention are very important in this group of patients. There are various cancers which are associated with aging. More than 12 to 23% of all cancers occur after the age of 65 years. Usually, elderly patients are put on conservative or less aggressive treatment. So they are denied benefits of aggressive treatment. Among elderly patients, cancer of prostate and lung is most common. Breast in women is more common. Breast cancer is more common. Men have 15 times higher risk of in elderly population. In women, 8 times higher risk than persons less than 60 years. Age-related macular degeneration, very common cause of loss of vision in elderly population, is degenerative disease, severe visual loss is seen, senescence of RPE, neurons, microglia, and endothelial cells, which accelerates age-related macular degeneration. RPE destroys external blood retinal barrier, and retina and choroid are affected. That results in severe loss of central vision, but rarely people who are elderly go blind from it. Now, what can we do to prevent or slow the aging process? Healthy aging is the focus for WHO aging policy by 2030. Aim of this policy is to develop targeted public health interventions to combat rising prevalence of metabolic diseases and promote healthy aging. That includes social support, lifestyle awareness, and health education for older adults. Physical inactivity is very important to be handled. The physical activity should be promoted. Community work should be given to elderly population. Workplace wellness program, recreational facility, and that may improve healthy weight. Behavioral changes and supportive environment for healthier future with lower metabolic disease is associated with improved well-being in aging population. If you look at the healthy aging, what can be done? Physical activity comes on the top. Mental health is second very important factor. Social engagement of elderly population is very important. Good nutrition of elderly population is equally important. Then comes fall prevention in elderly population. Coming to aging and its management, lifestyle intervention can be there, and there can be pharmacological intervention. In lifestyle intervention, it can be exercise, it can be dietary interventions, or weight loss when needed should be instituted. Another very important mechanism may be by modulating gut microbiota. Coming to pharmacological intervention, these are senolytics, xenomorphics, anti-aging drugs, antioxidants, and others. Metformin, we use day in and day out, is one of the xenomorphic drugs. Antioxidants being curcumin, ginkgo biloba extract, liraglutide, GLP-1 RA, and SGLT2 inhibitors have been used to prevent aging. Aging and age-related disorders can be handled by healthy aging and increasing longevity. And these are the various modalities: cell replacement therapy, cell transplantation, gene therapy, whenever needed, immunotherapy. This is an article, SGLT2 inhibitor to target kidney aging. SGLT2 inhibitors suppresses endoplasmic reticulum stress and oxidative stress in diabetic nephropathy through NRF signaling, a clinical and experimental study. This is what you can see. The aging can lead to senescence and ultimately there is disease progression and kidney damage can occur. I will like to end by a quote by George Burns, which says, "You can't help getting older, but you don't have to get old." Thank you very much. And if there are any questions, we'll be very happy to answer.
Dr. Professor Prabhat Agrawal, can you see the chat box or any questions from the audience?
Yes, sir.
Yeah, there are 3 questions.
So wonderful talk by Dr. Bijmohan, sir, as usual. Sir, there are 3 questions from the audience. First question is there any way to prevent sarcopenia in older adults?
Yes, physical activity is very important.
Yes.
Whenever you try to lose weight or reduce weight of elderly population, there is bound to happen some degree of lean mass also getting reduced. So physical activity, increasing physical activity in terms of walking, in terms of resistant training, that is very important so far as sarcopenia is concerned.
Dr. Brahman, apart from the physical training, they are in the market is super flooded with many nutrients, some drugs, and many other things. So, what is your opinion about that?
There is Dr. N.K. Singh. You might be knowing better than me, but they don't have any actual scientific proof of their validity. These various marketed products for sarcopenia, they basically contain some amount of protein, but they can lead to accelerated kidney damage that has been seen clinically in our day-to-day practice. What is your opinion?
Let first Dr. B.K. Singh tell what's his opinion about the drugs and these all protein products and other things.
I don't think it is at all effective. Like many nutraceuticals have been tried in this aging population, but few vitamins like vitamin D3 and vitamin B12 is effective in elderly population. But I don't think this protein products and some the product which has been marketed by many uh, uh, non-pharmaceutical industries and pharmaceutical industry are of any value, in my opinion.
Dr. Akash is here. He is the, I think, expert on this subject. Akash, what's your opinion?
Actually, in the elderly population, it is a myth that we cannot reverse aging. The aging can be reversed with all the proper interventions. Even sarcopenia up to the age of 80 has been shown to be reversed by proper exercise schedule, in which includes resistance training, as Dr. Brajmohan has already enumerated. But as far as the diet part is concerned, a proper caloric restriction and distribution of macronutrients, proper distribution of macronutrients is most important. If you are taking too much of simple carbohydrates or too much of saturated fats, especially if you combine saturated fats with carbohydrates, it is going to cause all the issues related to aging. So, calorie restriction and a proper distribution of macronutrients, a proper concentration of proteins is very much required because along with the resistance training and exercise, which is individualized as per the physical capacity of the individual, these proteins and these macronutrients do benefit. And I am sort of aware that Dr. Patni has a lecture on this in Diet Con, so I will request him to enumerate further.
Yeah, Dr. Patni has talked many times, and recently I also at the SCP, but let Dr. Patni summarize this.
So first and foremost, probably everything we try to put into sarcopenia, and that is very important because that is where probably the insulin signaling and the insulin resistance is affected. But what is more important is probably what Professor Brijmohan said. he actually took us through the whole aspect of aging, right? We were not only into the metabolic challenges, we were practically we were taken through all the aging related issues, which he has actually very well in a tutorial style, he has done it. So thank you for that, sir. Number one. Number two, already explained by Dr.
basically,
Brijmohan sir and Dr. Akash Singh.
Dr. Patni, it was basically because of your inspiration and your guidance that I into this.
Sir, this was very much required. I appreciate for the way you presented the stuff because you gave a whole gambit of all the questions related to aging. And I think right from the molecular mechanism to the various other, not only the metabolic diseases, but the other diseases and even the preventive and the management part as well. So thank you for that. But as far as the sarcopenia is concerned, and the resistance exercise is the one which already Dr. Akash Singh has pointed out, along with the proper nutrition, protein should be there. And the most important aging is what you said in the last, that is the psychosocial support. I mean, that is what is most important if you really want to have a healthy aging. And I would impress upon that. So this would be my point. Dr. M.K. Singh, sir.
Regarding
I think to summarize this point, this question, the first most important thing is that the sarcopenia can be prevented and it can be reversed too. So there are ways, and one very more important aspect also is the micro and micronutrients. Apart from the exercise, it plays the most vital role. Apart from some drugs are in the market like but not all studies are supporting those drugs. So we will not discuss that. So basically, these are the things, but most important, we are under-diagnosing sarcopenia and sarcopenic obesity. That's the so we need to make people and doctors aware that how to diagnose sarcopenia. That is a different lecture, but this is a very important thing. Then I think the second question, Dr. Prabhat, you can take.
One thing, sir, I want to add
Yeah.
regarding the sarcopenia, that the exercise should be supervised because there is
yes,
a chances of fall and the fractures are common in the elderly. So exercise should be structured and supervised so that they know the elderly people cannot get any chance of fracture or anything else.
These days, Dr. BK Singh, there is also a great issue about the SGLT2 inhibitors. Whether some person, suppose having the sarcopenia and for cardiorenal protection, you are giving SGLT2 inhibitors. There is a chance that it could be false and there could be other things. I mean that 70 plus people taking SGLT2 inhibitors and having sarcopenia also. Dr. Prabhat, do you prescribe?
Sir, it's a very debatable issue. Especially many people came to us when we were dealing with especially the diabetes. Everything is okay, sugar is well controlled. I have no problem. But whenever people or my relatives or friends are used to see me, they always say, कमजोर हो गया हूँ, वजन कुछ पैन ढीली हो गई है, शुगर ठीक है, कोई प्रॉब्लम नहीं है, मुझे वीकनेस भी नहीं लगती है. बट पीपल और रिलेटिव माय फ्रेंड ऑलवेज यूज्ड टू से व्हेनेवर दे सी मी कि सब पहले तुम ठीक ठाक कमजोर हो गए हो, कुछ ऐसा था, ये दवाई कुछ ऐसी लग रही है कि जिससे मुझे लग रहा है वजन कम हो रहा है. तो द मैनी पीपल केम टू अस इन दोस पेशेंट्स वी हैव टू stop or change medicine, especially SGLT, so that physically looking is very challenging, especially old age people. Young patient, yes, okay, no problem. But some people used to say in the evening, we know the SGLT sometimes causes the polyuria or the increased frequency in some patients. In the raat mein I was okay, no problem before this medicine, but when I was using this, there's increased frequency of this SGLT, and many times I have to pass to the toilets in the evening or the night. And sometimes patient used to come in the whole a day. And it is common with the very young patient, not usually with the elderly one. So this is something very challenging. So every patient should not be as a mass drug. We have to prescribe each and every one. Every drug should be customized. It should be tailor-made. And definitely there's few subset of patient which, despite control blood sugar, we have to stop it.
I think I agree, and most of people will agree what you told. But I think just 2 days back in Diabetologia, a very important article has been published. They have over 53,000 persons data taking SGLT inhibitors in plus 70 group. And they finally conclude that this is more a hype than the reality that the false occurs and other things happen. So I think we need also some Indian study on that. But anyway, you take the second question.
I like to intervene here, Dr. N.K. Singh.
Yes, sir.
The current data supports, if you want to go for organ protection, if you want to reduce aging, then SGLT2 inhibitor are to be used in elderly population. That is there. There is meta-analysis of 70 plus people which have shown that it protects organs. It reduces aging. That should be the clear-cut message here. Yes,
I think,
it cannot be used in all elderly population, but selected elderly population should be given benefit of SGLT2 inhibitor.
I
or
think,
maybe
definitely. I think Akash and Vijay Patni will be agreeing.
Yes.
Or Dr. Patni, do you have any
No.
opinion
Yeah,
on
yeah.
that?
Basically, what Dr. Prabhat said, there could be some issues with the patient, but monitoring of those patients is extremely important. It is our job to monitor the patients. It's not just not giving the medicine to those individuals. We need to understand their dehydration status. We need to understand their muscle mass. We need to understand the visceral mass as well. So considering that, we need to individualize the use of SGLT in those individuals who need it, particularly in those patients who have some risk factors for atherosclerosis or kidney status is concerned. So I would say it's not a mandatory stuff, but definitely most of the patients do need it. There is usually not an issue. It has some protective action, but definitely monitoring of those patients becomes very important. You need to monitor them, and most of the patients do end up with dehydration. And that is the major issues related to SGLT2 initially. But later, it is the visceral mass which is taken care of. So definitely it is going to be some benefit to the individual.
Okay,
I feel that aging is a very relative process. Many people now people are getting more and more health conscious, and many persons are quite fit even above the age of 70. So the treatment has to be individualized as per the patient status.
Yeah, second question, Dr. Prabhat.
The second question, I think, sir, is already answered in slides. What is the role of metformin, especially in the aging population?
Yeah, but we can discuss because this is a very common question. Everywhere we are being asked about that. So I think Dr. BK Singh, metformin and aging population. What's your opinion?
Yeah, definitely the metformin has some role because it acts on the mitochondrial dysfunction. So it has some role in aging population. I don't know exactly the data which is available, but metformin is definitely going to be effective in aging population. Only thing is the vitamin B12 deficiency, which is also common in the elderly population, particularly who is taking the vegetarian diet. So we should take care of this vitamin B12 deficiency state also.
So Dr. Brijmohan, anything to add?
Yes, in aging population, use of metformin should be done after considering chronic kidney disease stages. You must calculate EGFR in all elderly population before starting and go accordingly what the recommendation. But there is enough evidence as of now that these drugs, especially metformin, is going to reduce aging.
So you recommend even if patient is not having diabetes to take metformin to halt aging?
Not as of now. No, not as of.
Metformin basically has been shown to improve the glycemic parameters of the patient. The cardiovascular benefits are also there, and cognitive benefits are seen in a lot of studies basically. And there are some anti-cancer effects also. So
Yes.
in indicated patients where you have dysglycemia, it should be considered definitely, especially if the patient is having good renal function.
So, Dr.
So,
NK Singh,
yeah.
cancer patients who are elderly may be given metformin because it increases effectiveness of anti-cancer chemotherapy
Yeah,
in
I think
non-diabetic
that's
population.
very well said, sir. I think cancer, because it is also an anti-cancer drug, it is
Yes,
said. An anti-aging drug. There was a dermatology article saying that metformin can prolong life up to 100 years. So
yes.
lots of research is going on. So let us see what happens in the next decade. Third question, Dr. Prabhat.
Third question is how to effectively monitor the risk of metabolic syndrome in older adults.
Yeah, Dr. Bridge.
The same metabolic syndrome, you need to see whether the person is obese or not, whether hypertension is there or not, what is the level of HDL, what other factor, dysglycemia, if it is present, any 3 out of 5, if they are present, that it constitutes metabolic syndrome. So we need to get abdominal circumference more than 40 in males, if I'm correct, and 32 in females is indicative of obesity, abdominal obesity. And similarly, if their BMI is, that is weight divided by meter square of height, that should be seen. In India, we have a lower cutoff because everybody knows that fat content in India is higher at the same BMI. The YY paradox is very much prevalent in Indian population.
Yeah, I think it's sufficiently answered. Dr. Prabhat, there is one more very interesting
Yes.
question.
Sir, the last question is what is the basically it's about the ghee. Should we consume it or not? Especially, I think, pertaining to the elderly population.
Actually,
Yeah,
there has been recent publication that ghee basically has lot of antioxidants and it has lot of omega-3 also. And taken in judicious quantities, it is beneficial for the elderly also. That is very much said. But the dictum with saturated fats is that they cannot be combined with simple carbs. If you take simple carbohydrates with saturated fats, then they are bad for health. So basically, what you have to observe if you take ghee, which is saturated fat, is that simple carbs should not be taken together.
any difference of opinion? Dr. Patni, Dr. Prabhat, Dr. Bridge, Dr.
Dr.
BK Singh.
Prakash, do you mean that घी जो है वो पराठे पे लगा के खाना चाहिए?
I told in judicious amount. I did not tell that it should be taken in more amount.
I think
Then
this is a very
purity of the
controversial
ghee is very
question.
important.
Hmm?
Purity of ghee is very important. See, it's extremely important. Purity of the ghee.
Yeah, this
So
this
And
question is by
purity,
deficiency.
Dr.
purity of
Puttaraj
ghee is
Kia from
debatable, but
Tumkur.
in the
Yeah.
recent, this is a very hot political discussion
Yes.
in Tirupati.
So
So
that's
the
politics,
purity
sir.
of ghee is always doubtful in India, in any work.
Yeah.
So one
But
thing
as
is
far as yeah,
घर
BK
बना
Singh,
हुआ
as far as science
डॉक्टर
is
पाटनी,
concerned,
डॉक्टर पाटनी, घर का
hmm,
बना हुआ घी तो चलेगा ना?
घर का भी वही
कानपुर से
दूध
आया हुआ
है।
चलेगा
हाँ?
सर कानपुर से आया हुआ चलेगा बाकी का
कानपुर
कुछ
से है।
कंट्रोवर्सी रहता है हमेशा
but what I will tell कि भाई ऐसा है ना कि घी contains omega-3 fatty acid. So lots of literature is coming up where this is beneficial if you take in a little amount, that is 1 teaspoon maximum per day. But this is there is a person known as Dara Singh. He lived up to 84 years at high gram and 250 gram per day ghee he was taking. So this is not only about the saturated fat, there are other things also.
But
But
there,
this is a very controversial science, and by the there is no clear-cut answer today. But what I feel that it is in a small amount, it is really beneficial, and even for aging can be halted by that. There are some
Yes,
sort of
great.
research there.
Aging and healing
Yeah.
also improves. They say if you have a post-op wound and you use ghee, which is pure, not Tirupati Balaji ghee.
Yeah.
Dr. V.K. Singh has said. So that
In the
will
same, yeah.
We can
That
give a whole
Prabhat, in
session
the
on.
same way, if someone asks you ki whether this red wine or white wine halts aging, what could be your answer?
sir, basically मुझे लगता है these are the Western world sponsored things. As they are manufacturer of the wines or the whiskey, that's why they always recommend whiskey in a little amount, if you look. But any Indian data before this Western data, nobody recommends alcohol or the whiskey. Same with the ghee. As they don't have ghee, so they always criticize our ghee. And if you see, many people from the villages came to us, I am taking ghee 100 gram या 200 gram जैसा आपने कहा, Dara Singh is also was consuming
But
up
he
to
took also exercise, that amount of
Yes.
exercise
no,
also he was taking.
definitely elder people were they were working in the fields, they were working in the grasslands, they were going with the tube wells or the wells. So, but definitely ghee is not so. I think there is no bad thing about the ghee. Of course, ghee should be the pure, as we have discussed already. But quantity, as always, judicious amount, judicious quantity, quality should be there. But ghee is not bad as thing as the banaspati ghee or the we call it refined ghee. So I always prefer in my home personally. I'll ask my patient to use desi ghee and the sarson ka tel, mustard oil. Uh, if you compare with the area wise, in the southern part they always consume of the this palm oil, coconut oil. मलेशिया दे कंज्यूम पाम ऑयल तो जो भी जहां पैदा हो रहा है जैसे कि बात करें इन द आपकी तरफ अगर जाएंगे बंगाल में तो फिश दे आर प्रेफरिंग इन आवर पार्ट फिश इज नॉट देयर सो वी आर नॉट पीपल आर नॉट कंज्यूमिंग फिश सो इट डिपेंड्स ऑन द एरिया टू एरिया सो
But
जस्ट
definitely
अप टू
the
द
Bengali fish are much rich higher content of this omega-3 fatty acid, like hilsa
definitely
and
sir
other things.
definitely sir because they have the fresh I think fresh is one thing or definitely in our part we don't have any fish so we are just importing them from the Bihar or the Bengal. You know, every day their trains are coming with the fishes, big containers they are coming. So it depends on the area wise locality should be there.
So I think everything we have discussed, Dr. Brijmohan, did you touch in detail about the mind management? Because after all, this is also very important for keeping us
Yes,
healthy
I
and
did
for
say I did say that social engagement of elderly population is equally important. They should be given proper social environment, not leaving them to the old age home. If they have a family, they live longer. If they have friends, they live longer. And there are proved studies for that. So Indian tradition is again proved beyond diet that the good joint family is equally important for elderly.
so you are talking about the joint family and the Indian tradition that
Yes,
also matters.
I strongly
And I am getting patients from my area. वो बोलते हैं कि सर पेंशन माँ को जो मिलती है वो जब नहीं देती है बेटे को तो बेटा रोज उसको पीट रहा है तो ये ऐसे करके वो आते हैं तो ऐसे से भी कैसे जाते हैं so what to do how to do this is a very difficult
these
problem.
are these are the incidences which teach us that we should have a good joint family. I said good joint family. Joint family does not mean that आप अपना उल्लू सीधा करें और उसके बाद लात मार. That is not the tradition of Indian people.
I think in last we are 10, 12 minutes more have already discussed. But one thing that what about the control of blood pressure? Do you say that there is any target blood pressure range, systolic or diastolic, which should be kept for halting the aging and keeping them safe?
I personally feel that there is lot of controversial data available. Isolated systolic hypertension in elderly population is more prone to, they are more prone to get stroke as compared to those who are elderly but don't have isolated systolic. So if elderly population has isolated systolic hypertension, judicious use of it may be a small dose of diuretic, maybe if they can tolerate ACE inhibitor or ARB, that should be given, properly monitoring them that they do not develop postural hypertension. That is equally important. But
I think, excellently you told. So I think lastly, now I will request Dr. Prabhat Agarwal and Dr. B.K. Singh to give their take-home message, and Dr. Vijay Patni to conclude, and Dr. Akash to propose a vote of thanks.
So, thank you, sir. It was a wonderful discussion, wonderful talk by Brajmohan sir, and uh, it is always very pleasure to listen him. Uh, and as we have discussed, the sound mind, sound health, sound diet, exercise, especially strengthening exercise, proper sleep. We have to avoid some certain things like alcohol, smoking, especially saturated fats. Uh, with the age, we should reduce diet. We should we should take proper sleep. So this was the main things, these are the few things. Of course, there are certain medications which can which can delay the aging and prolong the good life. So with this, thank you. I invite Dr. Akash sir.
Dr. B.K. Singh, sir.
Sorry,
Yeah,
BK
Dr.
sir.
B.K. Singh.
Sir.
First of all, I really thanks the Dr. Brajmohan for excellent overview of the elderly diseases of elderly properly. I can say not only the metabolic challenges, but the whole overview of the elderly population which are suffering from the disease to the many psychological factors which is related with. But one thing, if you summarize the whole things, I think that aging population is very difficult to treat.
yes,
Very difficult to treat means what I want to mean to say that mainly we have to divide the aging population into two parts, which are dependent and others are independent properly. If they are independent, then if he can take care of himself, then the problem is slightly uh, tolerable or slightly easy to handle. But the patient who are dependent to the other, like if they have a very cognitive impairment, cancer patients, and the patients having in the wheelchair or the dependent, then the problems is more exaggerated and it is very difficult to treat. And in my opinion, the four things are very important. One is the hypertension, another is the diabetes. In particularly diabetes, the symptoms are only the incident diabetes early or the first time diabetes detected. The clinical features are very insignificant. Even the patient only says that मेरे को कुछ नहीं अच्छा लग नहीं रहा है, we are losing weight or something, incontinence of urine हो रहा है. These are the some findings, clinical feature which will present in the this aging population, and we should look after that and you try to get the thing there. And third important part is the cognitive impairment, and definitely the cognitive impairment and the degree of cognitive is very important in treating or managing the all metabolic diseases of the aging population. And fourth is, which is very important, and that is the what Brij Mohan sir had tell that the joint family, the social and emotional factor. This is very important. What to do after retirement, we can do in the patient, and there is no one to talk to him. So that is in one of the very important, and that will, if you can group the patient laughing society or something else, then can able to maintain this. So once again, I thank you very much. I have first time come to this CME India group, and definitely USB and all, Dr. N.K. Singh and all the faculty, all the members, Patni, Akash, all. Thank you very much for inviting me, and have a nice discussion with all of you. Thank you very much.
Yeah, Dr. Patni, conclude the whole session.
Okay. Thank you, Dr. N.K. Singh, for taking us through this particular symposia. And thank you, Brijmohan sir, for excellent deliberation on aging and fantastic moderation by Dr. Prabhat Agarwal and Dr. B.K. Singh. My few takeaway points are that first and foremost, promote healthy aging, number one. Number two is that you have to have a holistic approach towards patients who have challenges as far as metabolism diseases are concerned. So, care of comorbid condition and also monitoring of polypharmacy is extremely important, along with the most crucial point, that is the psychosocial support. And that will probably help the patient to take up the challenge of any metabolic dysfunction which he or she has. So thank you once again. I'll leave it to Dr. Akash Singh to give the vote of thanks, and if Dr. N.K. Singh want to intervene in between.
I thank Dr. Brij Mohan for delivering an excellent talk on metabolic challenges in aging population, a very pertinent topic because all of us are also reaching, moving towards that thing. And it is also very pertinent to know that, very important to know that a lot of these challenges can be addressed, can be retarded, and some of them can be reversed. So this was a very important talk. We'll have a video of it posted on all the CMA groups. I also thank Dr. Prabhat Agrawal and Dr. B.K. Singh for so excellently moderating this session and for answering the queries which were put up in the chat boxes. I thank Dr. N.K. Singh for conceiving and continuing on a monthly basis this CMA meetings, which are so knowledgeable and so important and so informative, and his vigor is definitely enviable. I thank Dr. Vijay Patni, who is a academician by heart and who is always there as far as the key academic sessions are concerned to give his valuable opinions, which basically we always are looking forward to. I thank the USV people for providing the platform and for comparing and for coordinating this session, and their presence and their continuous support to our academics is very important to carry out our academic endeavors and our academic efforts. So with this, I conclude this meeting, and I hand over the session for formal closure to Dr. Shweta Ghadge from USV.
Yeah, so I think we will end here with huge appreciation to all of you and thanks to all of you. And lastly, Dr. Sweta, this is your time to conclude and to say goodbye.
Yeah, thank you, Dr. N.K. Singh, sir. It is always a pleasure to come on the CME India platform because it gives us knowledge of various therapy areas, and I'm sure that the audiences, they are getting benefited in their clinical practice and also upskilling themselves through the knowledge sharing that happens on the CME India platform. I would like to thank Dr. Brij Mohan, sir, for again for the extensive presentation and for sharing a valuable insights. Dr. Prabhat Agarwal, sir, Dr. B.K. Singh, sir, for the moderation. Dr. Dr. Akash Singh sir and Dr. Bijay Patni sir for giving a valuable contributions. We will have further sessions also in the upcoming months. Thank you so much and have a good night. I request the technical team to end the session. Thank you.
Yeah,
Thank
good
you.
night.
Great.
Thank you.
Good night.
Good night.
Good night.
Good night.
Good night. Good night. Bye.
Good night.